The Lorenzo Gobbo injury. How can he survive being impaled on a wooden stake? Stay tuned to find out. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your #1 source for information on orthopedic injuries and broken bones that's easy to understand for the everyday human.
That's a little doctor joke we like to make around here.
So today we're talking about Lorenzo Gobbo, and we're trying to figure out just how it is that he survived being impaled on a wooden stake. Lorenzo Gobbo is a 17-year-old competitive cyclist from Italy. Lorenzo was injured on July 17th of 2019 while competing in a scratch race for the Junior and U23 European Cycling Championship. At the time of his injury, Lorenzo and several other riders were involved in a crash. All of the riders went down in a heap together, and a pedal from one of the riders struck a plank on the surface of the track, causing a 1-meter splinter of wood to be elevated into the air. Unfortunately, Lorenzo collided with this splinter, and he was impaled with the splinter exiting both the front and the back of his torso on the left-hand side. Lorenzo did not strike his head, and he remained conscious through the entire ordeal. Believe it or not, this type of injury is not uncommon in indoor track cycling, and there are other instances of riders being impaled by splinters that have come free from the track during an accident. Some other riders that have been injured in a similar manner include Malaysian cyclist Aziz Awang, who was impaled in his calf in 2011, and UK cyclist Jason Queally, who was impaled in his back in a race in 1995. So what happened to Lorenzo after he was injured? Lorenzo was immediately taken from the track and rushed to the nearby Jan Pelfagen Hospital. There he underwent a 3-hour surgery to remove the splint. Now, generally speaking, the treatment for this type of injury would include administration of tetanus toxoid if the patient's tetanus status were unknown or if it were not up to date, administration of IV antibiotics to prevent infection, irrigation and debridement of the wound to remove any dirt or contaminants from the area of the wound, or to remove any dead or necrotic tissue from the wound, a careful dissection of the splinter to remove it out of the body, and finally, a repair of any of the structures internally that had been damaged by the penetrating object. These are the procedures that were performed on Lorenzo during his 3-hour surgery. So what exactly was injured, and how can someone survive this anyway? The meter-long splinter entered and exited Lorenzo's chest cavity, puncturing his lung in the process. Fortunately, the splinter missed his heart and his spleen, which are both located on the left-hand side as well. Lorenzo may have also suffered an injury to his diaphragm on the left-hand side, but this injury was not reported. All things considered, Lorenzo was extremely fortunate because the path taken by the splinter managed to avoid 80% of his vital organs. Although the splinter did puncture a lung, it only punctured one lung, and basically you have two. So you have a spare, just in case. Or at least enough lung to keep you alive until they remove the splinter from the other one. After a successful 3-hour surgery, Lorenzo was kept in hospital in the intensive care unit. While in the intensive care unit, Lorenzo would likely be kept intubated, or with a breathing tube down his throat connected to a ventilator. This would allow his physicians to control his respirations to minimize trauma to the surgically repaired area in his chest. In addition, he would also have a chest tube connected to suction placed into his chest to help to remove all of the air outside of the lung that was trapped within his chest cavity. This would minimize the external pressure on the lung tissue within the chest cavity while it was healing. Once the lung parenchyma, or lung tissue, had adequately healed and the lung had reinflated itself, the chest tube would then be removed. The lung would be allowed to heal itself and to seal the puncture wound to eliminate the pneumothorax, or the air outside of the lung in the chest cavity. Lorenzo was kept in hospital for a period of 15 days before his release. And after this injury, Lorenzo is expected to have a full recovery. After his recovery, Lorenzo would be monitored for an extended period of time to make sure that he did not develop any additional pneumothoraces or pneumonia or pneumonitis. In other words, any additional leaks, inflammation, or infections of the lung. So, while not pleasant, we can see that it is in fact possible to survive being impaled on a splinter. Be sure to like, share, and subscribe, and keep your eyes open for membership options coming to this channel very soon. And as always, that's been a word, Dr. Chris, not your everyday ortho.
Just a flesh wound.